Let me give you a quick behind the scenes look at this course so you can see how it's structured and what you'll learn. All right, as you can see here, we're in our exertion exam and treatment course. There's 14 modules to this course, and each module is set up in a building fashion. So I want to give you some background before we go into the individual tests. And then after you do the tests, like what the heck do you do after you have the results of your tests? I'll walk you through that stepwise fashion, as this is something I do every week in the clinic. All right, let me look at this first module here. So it's set up where there's going to be a lecture format, so you have a good background of information. And there's important files here that are going to support the lecture. So this first one is going to be some PDF slides if you want to follow along or take notes. And then different templates or patient handouts that I use with patients. So you can navigate this course in this window if you want, and you can kind of work right through the course, or you can go back to this main page, whatever works for you. So after each module, there's a brief knowledge check section just to make sure you're getting the knowledge that we're going over in that module. So, but usually it's only 1 to 2 questions. It's quite brief. So we'll go through the Buffalo concussion treadmill test, the bike test. What do you do after the test? So how do you structure up if they're not passing, or if they pass? Like, how do you handle those situations effectively? We'll go through the pediatric concussion treadmill test. And then what do you do after exertion testing in regards to you're progressing someone back to like return to play, or maybe you're going back to work if it's a chronic working adult. And then we'll go through a few case studies of how we handle that. Just like all of our other courses, in addition to the brief knowledge checks, there is a post-course assessment here that you will need to get 80% on in order to get your CEU credit. You can take this as many times as you need to, but you will have to achieve 80%. And then course evaluation, and then you'll get your CEU certificate that'll be mailed out to you. All right. So my goal of this course is that you just feel really confident with doing exertion testing and exertion therapy with your concussion patients, because we know that it's very effective in speeding up recovery from concussion, and really it makes all your other interventions vestibularly or ocularly, it makes those interventions much more effective by promoting more neuroplasticity. All right, so we hope to see you in a course soon. Have a good night.